Welcome back to the Depression series. In today's session, we join Dr. Pereira, a consultant psychiatrist, and medical student Ishara as they explore how to assess the severity of depression and understand its causes.
Good morning, Ishara. Today we'll dive into something very important: how to assess the severity of a depressive episode and the etiological factors behind it.
Good morning, sir. I've been reading about the classification, but I'd love to understand how we apply it clinically.
Excellent. According to the ICD-10, we classify depressive episodes as mild, moderate, or severe, based on both the number of symptoms and their impact on functioning. Let's start with mild depression. What would you expect?
Two core symptoms, like low mood and loss of interest, and two additional symptoms.
Correct. And these symptoms are not intense. Patients usually remain functional, though they may struggle with motivation or concentration at work. Now, moderate depression includes at least two core symptoms, plus 3 or 4 additional symptoms, often with marked intensity. These patients typically have significant difficulty managing work or relationships.
And in severe depression, all three core symptoms must be present, along with at least 4 additional ones.
Exactly. These patients may barely function, and some may even be at risk of self-neglect or suicide. If psychotic features are present, like delusions of guilt or hallucinations, we call it severe depression with psychotic features.
What kind of hallucinations are we talking about?
Often auditory, accusatory voices, or olfactory, like smells of decay. We also see nihilistic delusions, believing they're already dead or that their organs have decayed. Once we assess severity, we must explore why this person developed depression. Causes are usually a mix of biological, psychological, and social factors. Let's start with biological causes. What comes to mind?
Genetics? Like a family history of depression?
Right. Also, medical illnesses, like stroke, diabetes, Parkinson's, or autoimmune disorders. Don't forget endocrine disorders like hypothyroidism, which can mimic or trigger depression. We also look at medications, steroids, beta blockers, chemotherapeutics, and of course, substance use, alcohol, heroin, even cannabis.
What about psychological factors?
Good question. Personality traits like low self-esteem or overdependence can increase vulnerability. Then we have cognitive distortions, like negative automatic thoughts or black and white thinking. These are addressed in CBT. Also, evaluate coping strategies. Not everyone handles stress the same way.
So, even interpersonal issues matter?
Absolutely. Poor relationships, especially unresolved issues from childhood, like early loss of a parent, can make someone more susceptible. Finally, social factors, life stressors like bereavement, financial crisis, job loss, or even a promotion, can precipitate an episode. We call these precipitating stressors.
Even positive life events?
Yes, because they require adjustment. The key is to assess both long-term vulnerabilities and recent triggers. So to summarize, we look at symptom count and intensity to grade severity. And when identifying causes, we assess biological, psychological, and social factors and how they interact.
Thank you, sir. It really helps to see the clinical picture more holistically.
Thanks for watching this episode of our Depression series. Don't forget to like, comment, and subscribe for more clinical insights. Coming up next, formulating a treatment plan for depression.